So excited to have everyone here. And even if I can't see you, I'm still excited that you're here. My name's Rebecca Buller, and you have joined the Wayside Women's Services ECHO. Today, we've got a couple of things. You've seen the PowerPoint that was just flipping by, and you can always see past ECHO presentations on our website in an archive. So if you ever want to see what we've done, it's there for you. We have some interesting things coming up, and we'll talk about that a little bit more at the end. I wanted to also make sure that you all take note that we've sent out our first issue of the ECHO newsletter, Wayside Women's Services ECHO newsletter. And once a month, we'll send things out. If you have feedback on that, we would love to have you respond to Lucia and share that with us. We're going to try to just, help build community, and that's what that tool is for. And if you have suggestions or ideas, maybe resources we could add on topics covered that month, we invite you to share them with us. Let's start with introductions today. I said that I'm Rebecca Buller, and we'll go around the room here, and then we'll start to invite our guests.
I'm Jessie Everett from Wayside Recovery Center.
And we have Lucia is here, and James is here, our IT manager, and also Sherry Fisher, who is new to Wayside and is sitting in the room with us. Let's go to Lindsay, and maybe you could just introduce yourself, and then we'll go to some of the other participants.
Sure. Hi, I'm Lindsay Smith. I'm the project director for the Minnesota Prevention Resource Center, and I will be doing a presentation in just a couple minutes.
Wonderful. Now, let's go to Tingist, and you'll need to unmute yourself.
Hi, can you hear me?
Not quite. Maybe a little louder.
Now?
Yes.
Mm-hmm.
So I'm Tigist Opheim. I'm currently a physician assistant, but back in school at LMU and developed osteopathic medicine to get my doctorate. I am currently a provider, and I'm very glad that I'm here. Thank you for all you're doing.
Oh, thank you. Okay, we have Kathy. Kathy, can you unmute yourself and introduce yourself? Kathy, can you hear me?
Yep, I can. I think I figured it out. Can you hear me?
Mm-hmm.
This is Kathy Johannick from Red Lake County Social Services. I'm an agency social worker and just here to learn and absorb new information.
Wonderful. Thank you so much.
Thank you.
Kaya, would you like to unmute?
Hi, I'm Kaya Foster. I'm a mental health postdoctoral resident at Hazelden.
Welcome. So glad you could join us. And finally, DJ Morris. Well, it looks like you might not have audio. If you would just put a little note in the chat, if you're able, then we'll know where you are and where you're from, and that will help us stay in touch. Now, if others join us as we go along, we can always check in with them later. But at this point, I want to turn things over to Lindsay and have her tell us a little bit more about what she's been doing.
Sure. So I am going to share my presentation with everybody, get that queued up. All right. So the title of my presentation this afternoon is Together We Can Address the Root Causes of Substance Abuse. And I titled my slides intentionally. I chose the concept Together We Can for two reasons. One is because substance abuse prevention, which is what we focus on, my team and I, is done most effectively through partnerships in the community. The model that we follow and that we encourage is having all key stakeholders in the community coming together, identifying really what the root causes are in that particular community for the different substance abuse concerns that are arising, and collectively finding solutions to move forward on a really specific strategy that addresses that root cause. So the model that we follow really is about collectivism and about those partnerships, and together we can. Also, what I'm going to talk about in terms of the project I'm a part of is that we are one of 3 projects that's funded by the Minnesota Department of Human Services that's here to offer any of you the support that you need to do substance abuse prevention work effectively, get started. But the point is that we're a system of services, and so that's one of the things I'm going to talk about. So together we can help you as well. I introduced myself already. Again, my name is Lindsay Smith. I'm the project director for Minnesota Prevention Resource Center. What I'm hoping that you'll leave with after today's conversation is that you'll be able to, or you'll be introduced to the system of services that I just mentioned, that you'll start to get to know who's involved in this work. I talked a little bit about that already, but get a better idea of who's involved, who those stakeholders are, where they're located in Minnesota, and how you might get connected to some of the efforts that are going on currently. I also want to share an example of what prevention looks like in action. Those of you who were able to introduce yourself already, it sounds like you probably have an idea of what prevention might look like, but it's kind of a nebulous concept too. And so what we try to do at the Resource Center is illustrate really what it is that people are doing and what the action of substance abuse prevention work really looks like. And then finally, I'd like to share with you where you can access free and low cost access to news on this topic, resources, and training through our project. I mentioned that we are a system of services. So the Minnesota Department of Human Services, specifically Behavioral Health Division, funds all 3 of these, and they each have a unique function, all intended to help you address the root causes of substance abuse in your community. So my project is the Minnesota Prevention Resource Center. We provide the information that you need. The regional prevention coordinators provide the in-person support that you need. I'll talk just briefly about them at the end of the presentation and how you might connect to the person in your area that can offer you that direct assistance. You may have heard their presentation on ECHO, I think a couple months ago. And then the third project is called Substance Use in Minnesota, and it's a website that offers you data. It helps you create graphs using the Minnesota Student Survey data and several other sources of data that are all specific to substance use, both behaviors, indicators of use, use rates, anything that you can think of related to that topic. It's a website that's meant to make data easier for you to use on this topic. So like I said, Minnesota Prevention Resource Center provides the information component of this system. And we do that in a number of ways. We do that by sharing stories of Minnesota community-based prevention work. We host training and professional development events. And we also are responsible for communicating the essential news, things that are going on related to this topic, and also information and resources about substance abuse in Minnesota. So I talked about sharing stories, and that connects to what I'm hoping you'll leave with today, which is who really is involved in prevention in Minnesota? What does she mean when she's talking about stakeholders? And a campaign that we've been doing the last year is called Get to Know a Prevention Champion. And this campaign highlights a variety of people who are involved in prevention efforts and really highlights how they are using their skills, their talents, their knowledge, their perspective to contribute to this cause. So the one that I pulled for you today is Josh Hopkins. He is a licensed alcohol and drug counselor who works at Gustavus down in St. Peter, Minnesota. And so in his day job, what he does, like you see on the screen, is he provides education and motivational interviewing for students that have violated the college's alcohol and drug policy. But Josh also has started up a community coalition in the community of St. Peter to start looking at substance use broadly in the community and start to identify what some of those root causes are for that use. So he is beginning to coordinate a more community broad effort by bringing in more stakeholders to that effort and to start having those conversations. I want to quick share with you a page from our website where all the other Get to Know a Prevention Champion stories are featured. We call this page Who Makes It Happen, meaning who makes substance abuse prevention happen. And like you see, we're featuring stories about people from all sort of roles and responsibilities in a community: pastors, county attorneys, students, law enforcement, public health, healthcare, people in media, higher education. So the idea here is that it takes a village, as they say, and so please feel free to read more about these different stories and get an idea of how people maybe in your field or in related field are interacting in this work. I also invite you to let us know if there's somebody in your network, in your world, who might make a good candidate for this, who is working on substance abuse prevention and who we could feature in this campaign. We're always looking for new submissions. I also wanted to share what prevention looks like in action. We are doing a series of video stories right now on our blog. And I wanted to share, I want to make sure you can hear my sound. Okay, there we go. I wanted to share Annie Tepfer's video. She is a coalition coordinator in Renville County, which for those of you who don't know where Renville County is, that's in the southwest portion of our state. And she leads a community coalition who has been around for over 10 years. And so I want to share part of her video because I think it does a nice job of illustrating how and why they came together and some of the strategies they've implemented, and then also what some of the results from that work have looked like. So I am going to take a minute and play part of Annie's video for you.
Before the coalition started, taking data from the Minnesota Student Survey in 2004, we found that we had like a 40% of our ninth graders in Renville County using alcohol in the past 30 days. Now that was much higher than the state average of 27%, and probably why we got our first grant to address this issue. And so we had to put together a comprehensive plan to try and address why we had 40% of our ninth graders using alcohol. Some of the strategies that we put together were curriculum in our schools for 6th through 10th graders. We have alcohol compliance checks that were initiated.
Sorry about the delay.
With the sheriff's office that had never been completed or done before. We have responsible beverage server trainings. We have town hall meetings. We have the Youth Leadership Academy. There's just many different strategies that we're using, and it's been working.
What does evaluation look like for your coalition?
Like I said, In 2004, we had almost 40% of our ninth graders using alcohol. Then in 2006, we got our funding first from the state. We started our coalition. 2007 was the next Minnesota Student Survey, and our rates went down a little bit, down to 37%. But by 2010, we really started to see the strategies, the initiatives were starting to make a difference in our community, and went down to 27% of our ninth graders. Then in 2013, we saw another drop to 14%. And then in 2013, it went down to 9%. And finally, 2016, our last Minnesota Student Survey, our ninth grade use rate went down to 5.8%. That's an amazing change of 85% change of reported behavior with our ninth graders.
How do you think sharing this will help others?
These strategies help youth into their adulthood by helping them to be aware and be prepared. It's a way to show youth that their community really cares about them. Every percentage point in the data equals a change in our kids' lives. Showing that prevention works is so compelling. It shows a great hope for your future and for your community.
All right. Again, apologies for some of the delay on that, but I hope that you still enjoyed hearing Annie's story. I love when she says that every percentage point really makes a difference, because I think that's so true. What prevention looks like in action really is about choosing strategies that are directly going to address those root causes, like I keep saying, and that's when results like what Annie shared really start to come into play. And so in order to do the strategies she talked about, that's where all of their different community partners, their law enforcement partners for compliance checks, their school partners for implementing curriculum, all of that comes into play, because in order to do that, you need those people involved and you need those people bought in. So again, that's why I say together we can do all of these things. So then another piece of what I said that you would see today is where is this happening in Minnesota? Where is this already going on? And what I have for you right here, if my browser will connect, is a density map of coalitions within Minnesota. So these are all things that I can share after the presentation if people are interested, but what this shows you is the number of coalitions that are currently active in each county of our state. So you can see that in St. Louis County, we have 12 active coalitions that are in some way looking at this topic. Here in our metro area, in Hennepin County, there are 6. In Ramsey, there are 3. Dakota County, 2. Washington County, 2. But you can see that it varies quite a bit, and that there's activity happening on this topic all over the state, which is really great and exciting to see. And so you can learn more about what that activity really looks like and what people are focusing on by getting in touch with your regional prevention coordinator, who I will talk about in just a little bit. But so this is all to say that there's a lot of activity happening all over the state. So what's a good way to get maybe started, aside from maybe connecting to your regional prevention coordinator to learn about what's happening in your area? Another really great way to start is to check out the Minnesota Prevention Resource Center website. It's very comprehensive with resources and news, training, more language about what we mean by substance abuse prevention and what that looks like. The videos are there. The Get to Know a Prevention Champion campaign, all that stuff is all available at our website. Another really great way of getting all this information just straight to your inbox in a comprehensive newsletter is to sign up to receive one or both of our 2E newsletters. MinPriv is our primary newsletter. It gets sent out 2 or 3 times a month, and it includes things like those videos I shared, like Annie's story. It includes event and training opportunities that are coming up that are relevant to this topic area, a curated list of things that have been in the news, and then other opportunities like grants that are available that are related to this work, job opportunities, all kinds of different things. So subscribing to this is a great way of getting a slimmed down version of all of what's going on and being kept in the loop. We also do a specialized e-newsletter called What's the Data Point? And this newsletter is intended to help you take data and turn it into action. There's a lot of talk about how important data is for everybody's work, right? And sometimes it can feel like you listen to statistics or you listen to a presentation that's full of graphs and then you go, okay, that's nice. And you're not exactly sure what to do with it or how to help that inform your work. And so that is what What's the Data Point is really all about, is what's the point of data? So it takes data, shares a relevant resource, and then suggests ways that you might take action on that particular issue that the newsletter is featuring that month. So that's a once a month publication. The other things I just wanted to quickly share with you about our website is that we have an easy to use online collection of resources. You can search by topic, you can search by resource type, the year something was published, you can do a keyword search. All sorts of things are available to you online there. We also have a digital library. So there are almost 200 books available for you to check out digitally for up to 2 weeks at no cost to you. You just have to create an account in our library. And so you can scroll through, again, tons of search functionality, and you can find whatever it is that you need and get right to the part of the book that you need, or read the entire thing if that's what you're interested in doing. But that's another new feature of our website that I wanted to make you aware of if you're looking for more information on this topic. I also mentioned that we provide and host a lot of professional development training. So we have what we call our core prevention trainings, and then also web-based and on-demand learning. Our core prevention trainings include substance abuse prevention skills and ethics and prevention. So these are your basic skills if you want to learn more in depth about how to start a prevention coalition, how to start doing a needs assessment in your community about this issue, how to take all of that information and move it forward, create a plan around this, really making sure it's intentional and it aligns with the needs of the community. That's what substance abuse prevention skills is all about. The ethics and prevention course is a look at ethics from the vantage point of people that are working on prevention, people who are working in community organizing. So that is available to you. There are courses coming up this summer. And then we also have been doing a number of web-based learning, all of which is also archived on our website in that resources section. So for example, last month we did a webinar called Substance Use Prevention, It's Good for Business. The business sector is a really important sector of our communities to engage in this work. And so we did a webinar talking about ideas for engaging business in this way. We find that community coalitions sometimes have or are unsure about how to engage that particular sector. And so we had that webinar that's available for you to watch and listen to on demand as your schedule allows. We also have a webinar coming up next Tuesday, actually, if it's of interest to you, called Uncovering Health Disparities, Racial Equity and Substance Use Prevention in Minnesota. It's going to be looking at the racial health disparity that exists in Minnesota related to drug overdose mortality. So if that sounds like a topic of possible interest to you, I encourage you to go to our website and read more about that and register for it. Again, it's free. And then finally, I wanted to talk to you about my colleagues, the regional prevention coordinators. I've mentioned them a few times. They are your in-person support folks. They're available to help you think about next steps with this. They're available to talk with you about, hey, I heard Lindsay on this ECHO presentation and she had a lot to say. She went through it pretty quickly. Talk me through this again. They're available to do that with you. They're available to just hear kind of what you're interested in and what you do and see or think about if there's a way to get started or something you can connect to that's already going on. And once you're further into the process, they're available to help you throughout the process, help you get connected to other stuff, get the resources you need either from us or elsewhere. They're really, really great kind of one-on-one support. And so their website is available there. There are 7 regions of the state, and so you would connect with the person in your area. I know that was a lot of information. Hopefully I stuck with my approximately 20-minute time frame.
You did wonderfully, Lindsay. Thank you.
Great. So I thought I would just open it up for questions, or Rebecca, go ahead and lead us through how you'd like to move forward from here.
Yeah, let's go ahead. And if you have a question, just go ahead and unmute and ask, or you can use the chat, and we're watching that as well. And maybe let's unshare the PowerPoint, because then we can see the chat a little bigger. Thank you.
Yep.
So if you don't have the ability to ask with your audio, just go ahead and chat and type something in, and we'll go from there. Any questions?
Great.
Lindsay, I'll start us off while people are thinking about their questions. I am really interested in what you how you titled the presentation about the root causes of substance abuse prevention, and I would assume that's evolving. Can you talk a little bit about how either your agency or the partner agencies you mentioned are looking into that, and what they have identified as some of the root causes that are being targeted? Sure.
So we talk about root causes because they vary depending on the community. Mm-hmm. We find that prevention is done most effectively when it's really community specific. Mm-hmm. So as an example, vaping right now is a big concern that everyone's talking about, right? Among our young people especially. Data came out a few months ago indicating that the first time in a really long time in Minnesota, tobacco use rates have gone up as a result of e-cigarettes. So for example, in one community, you may find that a root cause is that stores, retailers in their area aren't doing compliance checks. So the enforcement maybe is not as strong as it could be. And so a community may identify that as a root cause, work with their law enforcement partners to start doing those regular compliance checks to make sure that retailers are doing what they need. Similarly, a root cause might be that retailers aren't being trained on how to check IDs or manage their store properly to follow those compliance guidelines to restrict selling to young people. So again, you may work with your business retailers and your law enforcement to figure out how to address that root cause of the issue. With alcohol as an example, underage drinking, often a root cause that communities are working on is social access. So youth are getting alcohol from one another or from adults in the community. What does that really look like here in our community? Are there certain times of the year that increases? Are there things we could do around different community festivals that might change getting alcohol from older peers or adults? So that's what we mean by root causes. And that's why we think it's so important for communities to really dive into what happens in their community so that it's directly addressed.
Is there anything that's going on currently, specifically around the opioid epidemic, that you can share with us?
An example of that would be, commonly what I hear about is a root cause would be leftover prescription medication in people's homes. And so easy access to that. And so a solution to that particular root cause is people taking prescription medication that's not theirs from other people's homes is proper disposal of prescription medication that's left over that you aren't using anymore. So that's been the sort of genesis of the prescription drop box movement, if that is familiar. So having a dedicated drop box for people to bring their leftover prescription medication to dispose of it properly, not flushing it because that's bad for our environment, but getting rid of it so that it's not accessible to people who it's not prescribed for.
Awesome, thank you. Looks like there's one in the chat box. You want me to read it? Are there such programs for the Appalachian Mountain people? Do you know?
Gosh, that's a very specific question. That's a great question. I don't know if there's a specific set of services like what I'm talking about that is for that community of people. I know that there is a lot of work being done in Appalachia on the opioid crisis as an example. Because we're not in that, because I'm not personally in that area, I'm not sure of the specifics of what's going on there. But it's certainly something that I could look into to see if there's a similar sort of system of services like what I described is here in Minnesota in that area too.
Does every state have a prevention resource center model or no?
It varies a little bit. We're actually doing some work right now on forming a better network across the country of resource centers on this topic area and what their model looks like. So most states have some kind of infrastructure like I described to work on this topic area. They vary as to how they're structured, and that's all part of what we're working to figure out right now, and to do better sharing across the country about what works for people to get the information and the support to the community level where I'm saying this work really happens, to make sure that you all have what you need to do it well. So it's in progress.
Tigga said, I understand. I'm licensed in Minnesota, but going to school in Tennessee and see such an epidemic of SUD. Thank you, Lindsay, for answering.
Well, and if we get more information from Lindsay, we'll make sure it gets to you, okay?
Perfect.
Could the person on the phone introduce themselves?
Yeah. Is it Tassa? Or
No, the person on the phone.
Oh. Yes, there's somebody at 612-873-1000, maybe? Can you let us know who you are? Well, pleasant, but not a person.
Tassa's from Mother Baby. Maybe you want to have her say who she is?
Yeah, Tessa, will you introduce yourself, please? Maybe you don't have a microphone. If you are able to type in, just let us know. We know that you're from the Mother Baby program, and we're glad you're here. So hopefully you can hear us. And if there's anything you'd like to say, please use that chat box and we'll share it. Any other questions? All right. Thank you. If you think of something while I'm talking, go ahead and pipe in. I want to just kind of wrap us up, and we'll get done early if there isn't any more questions. Now, this is it our first time available to have the CE confirmed? Yes, so that's anyone here who's licensed through the Board of Behavioral Health. We have been approved to offer continuing education for this experience. And all you need to do is Lucia will send you a evaluation and feedback form, complete it, and let us know your licensure. And then we'll send back out a confirmation of your attendance with that, and the information that you need to keep for a possible audit or something like that. So I think we know who everyone is except the person with the beautiful music. So that's why it's so important that we know who's on the call so we can confirm. We also want to talk about what's coming up in early March 7th. We'll be hearing about No Wrong Door. And that should be exciting. We're working on a subject for March 21st. We've had a cancellation and reschedule. So we'll if you've got an idea, something that you've been wondering about or wish you knew more about, let us do the legwork. Give us an idea, and we'll try to get someone to come in and talk about it either on March 21st or at a future date. If you have a topic you'd like to present on, or you're with an organization that you'd like to highlight, please let Lucia know that as well, because we want to learn about everybody in our learning community. I think those are my announcements. Anyone else want to ask or chime in with some kind of contribution? All right then, Lindsay, thank you so much for spending time with us. And I hope that this has been helpful. I know I've been had benefit from working with you on things, and hopefully it'll keep growing as I work on projects. And also, we had the presentation from our regional coordinators, and I find that they're very, very helpful. So I encourage everyone to find out who's in your area and make a connection.
Yeah, definitely. They would love it.
Yeah. Thank you so much, everyone. Have a great day and enjoy the sunshine.
Yeah. Bye, everybody.
Bye-bye.
Thank you.
Thank you.
Thank you.